Welcome to Data Chats, a Metopio podcast where we talk about turning community data into real-world action. Each episode, we explore how leaders across public health, hospitals, and policy use data to understand their communities, shape priorities, and drive change. Let's dive in. I'm really excited to just be talking through some data slides today, Heather. I've pulled together a few slides related to rural benchmarks. We have added US rural benchmarks for the entire country, which we didn't have before. Before, we just had a rural benchmark for each individual state, but now we have rural benchmarks for the entire country. And I think this is interesting because you can see that a large portion of the country is rural for us.
And yeah, I think this is a really interesting view, both because of that space, but because this is a very small number of people from the whole country. It's less than 20% of the population, but something like 75 to 80% of the land space. And so compared to a really densely populated city, this is a very different landscape of where people live and the resources available to them.
Right, that's a good point. I pulled in diagnosed diabetes here only because I thought it was kind of interesting to think about, even though everything shown here is rural, there are still differences between rural communities in different parts of the country. So it might be in some cases useful to compare to a rural benchmark in your own state or sometimes to the entire country.
Mm-hmm. So I love this visual. This is very, very much what Metopio provides in our platform. We map things. That's what we do. But really, this data is very much like a lot of the data that we put in. It's a combination of the Centers for Disease Control surface data, the survey data, and the places data, which is small area estimation from that data. But diabetes incidence can be gotten from a lot of different places. I know there's sort of a question of whether that data is going to be available in the long term. We ask these questions in our own surveys. We get this data from other sources that have access to claims, access to Epic directly. A lot of different sources come up with the same information. This one is from Places, and we do still have access to it. And it reflects what people have said in a survey about their own health. And it does, as you say, it tells you something about what it means to be rural, but also how different a rural area can be in a different part of the country. The rural South is very different from the rural Northeast, very different from the Plains states.
Right.
Being in a Native American reservation is very different from anywhere else, and you can see some of those popping up here. But really, all of them have some things in common. There are some things that are just going to be different no matter what. But yeah, it gives you one more way to look at where you are and who you can compare to.
This plot I pulled in because I think it's a good plot to show why we care about rural benchmarks. Coles County is a rural county in Illinois. And if you were to look at cancer mortality and compare Coles County to the US and Illinois, you might say, wow, we are doing horribly in this metric. But if you compare Coles County to other counties like itself, it's actually doing a little bit better in terms of cancer mortality. So this plot just kind of underscores why we care about rural benchmarks.
Mm-hmm. And I think it gets again to, what those different resources are in a rural area. When we're talking about rural areas, you're generally going to have, less access to specialty care, less access to healthcare in general, greater distances to travel for anything, but especially for something like cancer care. And so it could be related to people not being able to get in to get their usual screenings. Could be related to outreach. It could be related to rural hospitals closing. It doesn't tell you why, but it does tell you that there is a certain consistency across the country, that there is something different about being in a rural area, and the intervention that could help there may not be the same as the intervention that's going to help in a much more densely populated area.
This is actually related to something else I pulled in, which is this. And this is, I think, exactly what you spoke a little bit to, which is that a lot of times in rural communities, people just don't have the access to specialty care So, for example, my mom lives in a rural community and she fell on the ice and got a concussion
Ooh.
like 2 years ago. And they took her to their local, there happened to be a local hospital there or a place with some beds, a clinic with some beds. And she was held overnight, but for 2 days, she wasn't able to get a neurology consult because there
Mhm.
were no neurologists in her county. Um,
Right. And
so
that's
that
exactly
just,
what this is showing. When you say, like Illinois on average has 116 specialist physicians, all specialties, but specialists per 100,000 residents. That's more than 3 times the Illinois rural benchmark, more than 4 times, if I'm doing the math right.
mhm,
Um, that's huge difference, and that's a huge difference in people's experience and in the how quickly they can get care, just like in your mom's situation. But again, that is really consistent across the country. The Illinois rural benchmark at 27 specialists per 100,000 is a little higher than the US rural benchmark. There are places that have many fewer physicians than even Illinois rural areas.
mhm.
So as we saw on the first slide, there's variation, but it is a variation in a band that is remarkably consistent.
Yeah. So we're talking about differences in access to care. I like what you also brought up about preventative medicine because there's a there's less access to that preventative care, which often leads to the worst health outcomes. And then people are in the hospital for avoidable hospitalizations or avoidable ED visits. I put this plot in because I don't want to only shed a negative light on rural communities because we know that there are so many positive things about rural communities, a sense of community for one, and not every metric is going to be worse in a rural community. So here we're looking at HIV incidents, and these rural areas are actually doing much better than Cook
Mhm.
County in the United States.
Yeah, there are definitely, I mean, there are differences. It's as you say, it's not just all worse. There are things that a rural community is a little bit insulated from, perhaps. And then, as you say, there's resilience. There's the sense of community. There's the people who have been there for generations. and uh, and those things, they don't prevent HIV, but they do build that community in a different way than an
Mhm.
urban community can be. So yeah, I mean, it works in both directions. There are definitely things that are harder to do when you're that far apart, and then there are things that you're insulated from. So yeah, it's good to see both sides.
One thing that I hear from clients, like some questions I get is why are we using HRSA rural benchmarks?
Mhm.
Why not some of the other
Oh, there are
definitions of rural?
tons. Yeah, the HRSA definition, it is the Health Resources and Services Administration that is a part of Health and Human Services, part of the government. And they actually have a whole page on how they built their rural definition. It is similar to the census definition. It is similar to the Office of Management and Budget definition, but it is particularly meant for healthcare. And that is why we chose this one. We've aligned our rural benchmark by county with the HRSA definition because it is meant to be relevant to healthcare in a way that the Office of Management and Budget or the census may not be as specifically interested in. Thanks for listening to Data Chats. If you found this episode helpful, subscribe to get future episodes delivered straight to your inbox. And if you want to explore the data we talked about today, visit metopio.com to see how we help public health departments and hospitals turn insights into action. See you next time.